Gentlemen, let me ask you an important question. How many times did you wake up last night to urinate? Has your urine stream become weaker than it used to be? Do you ever feel like your bladder never completely empties? Or have you simply accepted these changes because you are over 60? As a urologist, I hear this every day. Men tell me, "Doctor, I thought it was just age." But that belief can be dangerous. While prostate changes are common after 60, ignoring warning signs can lead to worsening urinary problems, bladder strain, infections, and in some cases, serious prostate disease. Your prostate may be small, but it has a huge effect on your quality of life. It surrounds the urethra like a ring around a garden hose. When it enlarges, becomes inflamed, or develops problems, it can slowly squeeze that hose, making it harder for urine to pass. And this does not only affect the bathroom. It can affect sleep, energy, confidence, stamina, and even erections. Today, I'll share 4 warning signs that your prostate may need attention after 60. And stay with me until the end, because I'll reveal the biggest mistake most men make with prostate symptoms, and it is the mistake that can quietly turn a manageable problem into a serious one. But here's what most men don't realize. Waking up at night to urinate is not always harmless. Gentlemen, one nighttime bathroom trip may not seem like much. But when you start waking up 2, 3, or 4 times each night, your body is telling you something. Frequent nighttime urination is one of the most common prostate warning signs after 60. Many men laugh it off. They say, "That's just part of getting older." But common does not mean you should ignore it. Your prostate sits just below the bladder and surrounds the urethra, the tube that carries urine out of the body. When the prostate enlarges, it can press against that tube. Think of the urethra like a garden hose. If someone gently steps on the hose, water still comes out, but the flow becomes weaker. Pressure builds behind the pinch. The system has to work harder. Your bladder behaves the same way. If the prostate narrows the passage, the bladder must push harder to empty. Sometimes it cannot empty completely. When urine remains behind, the bladder fills again more quickly, and you wake up more often. Nighttime urination is not only a bladder problem. It is a sleep problem. And poor sleep can affect nearly everything. Deep sleep is when the body repairs blood vessels, supports hormone rhythms, restores energy, and helps the brain recover. If you wake up again and again, that repair process gets interrupted. Testosterone support can suffer, energy can drop, concentration can worsen, mood can change, stamina can decline. Even erections may become weaker because sexual function depends on sleep, hormones, blood flow, and nerve health. Think of sleep like your body's overnight repair crew. If the crew keeps getting interrupted, the repairs never fully finish. Now, nighttime urination can have many causes. Drinking too much fluid late at night, alcohol, caffeine, sleep apnea, diabetes, certain medications, and heart or kidney problems can all play a role. But for men over 60, the prostate must be considered. The hopeful solution is not panic. The solution is awareness. Start by noticing patterns. How many times do you wake up? Is it getting worse? Do you drink a lot before bed? Do you use alcohol or caffeine in the evening? Do you also have weak stream or urgency? Simple changes may help some men. Reduce large amounts of fluid 2 to 3 hours before bedtime. Limit evening alcohol and caffeine. Empty your bladder before bed. Stay active during the day. But if nighttime urination persists, worsens, or affects your quality of life, talk to a healthcare provider. Do not let embarrassment keep you silent. This first warning sign is often the body's early whisper. But the next sign is even more direct, and many men notice it long before they admit it. But here's what most men don't realize. A weak urine stream is not just an inconvenience. It can be a sign that your bladder is working harder than it should. Gentlemen, many men first notice that urination takes longer. They stand there waiting. The stream starts slowly. The flow is weaker. It stops and starts. They may need to strain. At first, it seems minor. But over time, it can become frustrating and concerning. This often happens when the enlarged prostate narrows the urethra. Again, imagine a water pump trying to push water through a partially pinched hose. The pump must work harder. Your bladder is that pump. It is made of muscle. When the outlet is narrowed, the bladder pushes harder to force urine through. In the beginning, it may compensate. But if the problem continues for years, the bladder muscle can become overworked. Eventually, it may weaken. That is when men can have more difficulty emptying, more urgency, more frequent urination, and sometimes urinary retention, where they cannot urinate properly at all. That can become serious. Some men also feel like they never fully empty their bladder. They urinate, leave the bathroom, then feel the urge again soon after. This can happen because urine remains in the bladder. Leftover urine can increase the risk of infections or bladder stones in some men. Now, a weak stream does not automatically mean cancer. Most often, in men over 60, it is related to benign prostate enlargement. Benign means non-cancerous, but benign does not mean harmless. A non-cancerous problem can still damage quality of life and bladder function if ignored long enough. The hopeful news is that urinary symptoms are often manageable. There are lifestyle strategies. There are medications. There are procedures when needed. There are evaluations that help determine what is actually happening. But you cannot treat what you keep denying. If your stream has changed, pay attention. If it is getting weaker, pay attention. If you strain, dribble, stop and start, or feel incomplete emptying, pay attention. Your body is not trying to embarrass you. It is trying to warn you. And the earlier you listen, the more options you usually have. But prostate warning signs do not always stay limited to urination. The next one surprises many men because it can affect confidence, intimacy, and relationships. Mistake number 3 might surprise you. Changes in erections or ejaculation can sometimes be connected to prostate health and overall male health. Gentlemen, I want to handle this carefully. If your erections become weaker or ejaculation feels different, it does not automatically mean you have prostate disease, but it does mean your body deserves attention. Sexual function is complex. Erections depend on blood flow, nerves, hormones, sleep, mental state, and vascular health. Ejaculation also involves the prostate, pelvic muscles, nerves, and the reproductive tract. Think of sexual function like an electrical system in a house. Several wires must work together. If one wire is damaged, the lights may flicker. If several systems are under stress, the problem becomes more noticeable. For men over 60, changes in urinary function can create stress and poor sleep. Poor sleep can reduce testosterone support. Stress can affect arousal. Poor circulation can affect firmness. Prostate inflammation or enlargement may contribute to discomfort or changes in ejaculation. Everything is connected. The prostate is not isolated from the rest of the body. Neither is the penis. If you wake up 5 times a night, feel exhausted, worry about leakage, and avoid intimacy because you feel embarrassed, sexual confidence can decline. If blood flow is weaker, erections may suffer. If inflammation is present, discomfort may affect desire. The important point is this: do not treat sexual changes as shameful. Treat them as information. Erections can be an early warning sign of circulation problems. Ejaculation changes can sometimes point toward prostate or medication-related issues. Reduced libido may connect to sleep, hormones, stress, or general health. A man who ignores these signs may miss an opportunity to protect his health earlier. The hopeful solution is open conversation. Talk to a clinician. Be honest. Doctors hear these concerns every day. There are ways to evaluate blood pressure, diabetes risk, hormone levels when appropriate, prostate symptoms, medication side effects, and circulation. And many men improve when the real cause is addressed. Better sleep, better blood flow, better prostate management, better confidence, better communication with a partner. But now we move to the warning sign that requires the most urgency, because some symptoms should never be watched casually at home. But here's what most men don't realize. Pain, blood, fever, or repeated infections are not symptoms to ignore. Gentlemen, if you see blood in your urine, if urination burns, if you have pelvic pain, fever with urinary symptoms, or repeated urinary tract infections, you need medical evaluation. Do not wait. Do not guess. Do not assume it is just prostate aging. These symptoms do not always mean cancer. Many times, they may be caused by infection, stones, inflammation, significant prostate enlargement, or bladder issues. But they are warning signs. Think of them like a check engine light on your car. Ignoring the light does not make the problem disappear. It usually gives the problem more time to worsen. Blood in the urine should always be taken seriously, even if it happens once. Painful urination can suggest infection or irritation. Fever with urinary symptoms can signal infection that may need prompt treatment. Repeated infections in men deserve investigation because male urinary infections are less common than in women and may indicate an underlying issue. Pelvic pain can come from prostate inflammation, bladder problems, or other causes. The hopeful message is that early evaluation often brings clarity. A urine test can check for infection or blood. A physical exam can assess prostate concerns. PSA testing may be discussed depending on age, risk, symptoms, and medical guidance. Imaging or referral may be needed in certain cases. The point is not fear, the point is action. Men often delay because they are embarrassed, but a medical visit is far easier than an emergency. And catching a problem early is almost always better than waiting until it becomes severe. Now we come to the biggest reveal. Most men never realize this until it's too late. The greatest prostate mistake is not one symptom. It is waiting too long. Gentlemen, this is the danger I see again and again. A man wakes up at night to urinate. He ignores it. Then his stream weakens. He ignores it. Then he feels incomplete emptying. He ignores it. Then his sleep suffers. His energy drops. His confidence changes. His erections weaken. He still ignores it. Then one day he cannot urinate properly, or develops infection, or gets frightening test results, and finally seeks help. Most men never realize this until it's too late. The issue is not that every symptom means something terrible. Most prostate enlargement is benign and treatable. The issue is that delay steals options. Delay allows the bladder to strain. Delay allows sleep to deteriorate. Delay allows infections to recur. Delay allows fear to grow. Think of prostate symptoms like a small leak under a sink. At first, it is just a few drops. Easy to ignore. But if you leave it long enough, the cabinet rots, the floor swells, and the repair becomes much bigger. Your body works the same way. Early symptoms are often whispers. Do not wait until they become shouts. The hopeful truth is that prostate problems after 60 can often be managed very well. Lifestyle changes can help. Medications can help. Procedures can help. Monitoring can help. Medical evaluation can help separate common benign problems from more serious conditions. You do not need to panic, but you do need to pay attention. Remember the 4 warning signs: frequent nighttime urination, weak urine stream or difficulty starting, changes in erections or ejaculation, pain, blood, fever, or repeated infections. If any of these are affecting your life, your body deserves attention. And gentlemen, it's never too late. Your body can heal. Your sleep can improve. Your urinary control can improve. Your confidence can improve. Your energy can return. Your sexual health can improve when the underlying problems are addressed. Do not let pride keep you silent. Do not let fear keep you frozen. Do not let age become an excuse to ignore your health. Start today. Track your symptoms. Reduce evening bladder irritants. Stay active. Maintain a healthy weight. Drink water earlier in the day. Limit evening alcohol and caffeine. And most importantly, speak with a qualified healthcare professional if symptoms persist, worsen, or concern you. If this video helped you, subscribe for more practical men's health advice for men over 50 and 60. And tell me in the comments, which of these warning signs surprised you the most? Nighttime urination, weak stream, sexual changes, or pain and blood? Take care of yourself, gentlemen. Your future self will thank you for it.